Cancer and many cancer treatments can lead to a loss of appetite, and eating well can sometimes be very difficult. It's important to stay as well as possible and prevent unnecessary weight loss so that you are fit enough to continue with your treatment and to make a quick recovery afterwards. You may be experiencing some symptoms or side effects such as nausea, vomiting, diarrhea, constipation, or pain. All of these can lead to a loss of appetite, so it's really important to discuss them with your doctor or specialist nurse. They may well be able to help by prescribing some medication and hopefully be able to help you eat better. This video will provide you with some useful tips if you're eating less than normal or can't manage your usual meals or are losing weight. As a general rule, a diet higher in fat and protein is recommended during cancer treatment. These foods provide more energy in small amounts, making it easier for you to eat what you need. If you have high cholesterol, diabetes, or another medical condition that has meant you've had to change your diet in the past, and you're not sure that the suggestions in this video are suitable, then please speak to your doctor, specialist nurse, or dietitian. If your appetite is poor, you may find that your usual portion sizes are putting you off eating altogether. You might find it easier to eat more often during the day rather than 3 meals, and snack between meals. Try to manage what you can at meal times, but don't worry if your portions are smaller than previously. If you're not eating all of your meals, try and include a snack or a nourishing drink between meals. Snacks can be sweet or savoury, depending on your taste. You could choose a pot of yoghurt or a pot of custard or rice pudding or a mini sausage roll or pork pie or even a slice of cheese. Nourishing drinks can be really useful between meals. These can include a hot or cold glass of milk, particularly whole milk, or if you prefer something sweeter, a hot chocolate or Horlicks or even Ovaltine can be made with whole milk. You might like a milkshake or a smoothie or a glass of fruit juice. If you're struggling to eat all of your meals, try and eat a pudding more regularly, because this will add extra calories and energy. You could maybe have a pot of yogurt or a pot of custard or some tinned fruit with ice cream. You may find it particularly difficult to eat a main meal at the end of the day. If this is the case, opt for a snack type meal instead. Just make sure that you're not skipping so that you have something nutritious at regular times during the day. Having a nourishing meal doesn't necessarily mean eating meat and 2 veg. A hot or cold snack can be just as good. You could have a piece of toast with a topping such as sardines or tuna or egg or beans. If you're too tired to cook, please don't worry. Convenience foods and ready meals are just as good, and it'll take less time and use less energy. You may find eating a pudding instead of a main meal easier to manage, so have apple crumble and custard for your tea. This might sound like the best diet you've ever heard of, but actually when you're struggling to eat and drink, it's really important that you get energy from small amounts of food, which will help support you through your treatment. If you're only managing small amounts at your meals, there are lots of ways of enriching your food so that a smaller portion can go further and give you all of the nutrients that you need. You could add cream or jam or butter to porridge and puddings. You could add grated Parmesan, cheddar or feta cheese to soups and mashed potato, pasta dishes, beans or spaghetti on toast. Many foods can be enriched by adding a little extra oil, butter, spread, mayonnaise. Skimmed milk powder is also a really useful ingredient. It can increase the protein and calories in milk and other drinks. It can be added to all sorts of things, including mashed potatoes, sauces and soups, custard and puddings, as well as milkshakes. When adding skimmed milk powder to milk, use 2 to 4 tablespoons for each pint, and preferably use whole milk. What you want to do is mix a little bit of milk with the milk powder to make a paste, and then keep stirring and adding the rest of the pint. When you've got a poor appetite, you might find that actually drinking is easier than eating. Nourishing drinks are a really useful source of energy and can be used as extra snacks at any time of the day. You should try and drink at least 8 to 10 cups of fluid each day. This is equivalent to 4 or 5 pints of liquids per day. It might seem like a lot, but it is really important to remain hydrated during your treatment. If you're losing weight or you're struggling to eat all of your meals, drinking nourishing drinks is probably better than a glass of water. It all counts. If you like it, try and have at least 1 pint of milk each day. You could also have milkshakes, Horlicks, Ovaltine during the morning and the afternoon as snacks. Spread your drinks through the day and try to avoid drinking too much at meal times because it will fill you up. Remember to have a drink and a little snack near you at all times. This will help to remind you to keep eating and drinking throughout the day. When you are not eating well, this may cause some tension with family members at home who are worried about you. Try and help by just having a small portion at each meal to put them at their ease. Friends and family want to help, and food is one way that they can. Talk to them about it, talk to them about how you feel, and try and reach a compromise. There's a lot of information and ideas on snacks, toppings, puddings, and nourishing drinks in our Eating When You Have a Small Appetite booklet, which you can download from the Royal Surrey County Hospital website. National guidance recommends that anyone with a cancer diagnosis should increase the amount of protein in their diet. Proteins are the building blocks of the body. They're essential for making new cells, such as blood cells and hormones, and also to help repair old cells. They help with wound healing and keep your muscles strong. When you're unwell and your body needs more protein, it's therefore important to make sure that you're eating enough protein in your diet to get better. Protein is mainly found in meat, fish, eggs, beans, pulses, and dairy foods. There is detailed information on our patient information leaflet, How to Increase the Protein in Your Diet, which you can access from the Royal Surrey County Hospital website. You might also want to download or order Macmillan's booklet, The Building Up Diet, or Macmillan's recipe booklet. Hopefully, the tips in this video will help you to manage your appetite better so that you can eat differently and stop losing weight. Remember to always discuss your symptoms with your doctor or nurse, and if you're not able to stop losing weight, ask for help or to be referred to a dietitian.